Welcome to USMD Prostate Cancer Center, a comprehensive world-class cancer treatment facility and the only one of its kind in the United States. USMD Prostate Cancer Center offers every option available for the treatment of prostate cancer, one of only 12 centers in the U.S. approved to test the breakthrough HIFU treatment for prostate cancer. USMD Prostate Cancer Center continues to help pave the way for treatment and cure of the disease.
There's a few things about prostate cancer that I think people need to realize. I mean, one of the biggest challenges that we've had, certainly over the last several decades, is actually, number one, is finding the cancer. And I think that as we continue to progress in not only just the diagnosis and the treatment of prostate cancer, is trying to get to the area of where the cancer is located. And let me explain this for you real quick. If you look at a prostate, the average size of a prostate is a little bit bigger than a golf ball. When we actually do a biopsy on this, we actually take several needles inside of that, and we've actually gone through several different progressions of how we put needles in, et cetera. And so we numb up the patient. And routinely, it's a relatively benign, process, easy process. It takes about 10 minutes in the office. Now the question is can we get any better at actually finding those cancers? We're not at the level where we can say that person has a nodule right there, and that's a bump, and that's cancer. You still have to confirm that with a biopsy. However, we're getting better, and we're a whole lot better now than we were 5 years ago, and certainly much better 10 years ago. Now, I segue that into actually where we are today. And the goal here is the fact that we are now, compared to where we were 10 or 15 years ago, is that we continue to progress in terms of the gold standard for treatment of prostate cancer. If you look at the gold standard, it's actually removal of the prostate, and patients can actually do fantastic with that. However, is there another way in which we can treat prostate cancer that is potentially less invasive, which is even less invasive than doing it robotically and laparoscopically? And is there a way in which we can continue to push that envelope to make sure that we're causing less issues for the patient, particularly with the potential for erectile dysfunction and urination and incontinence? When we have prostate cancer, when a patient has prostate cancer, the first thing we want to try to figure out is, number one is, did we get a good sampling of that prostate? Assuming that we did, then we go forward with that patient and try to figure out, is this a patient we need to treat? If we're going to treat this patient, now we actually start going into different modalities for this. And the question is do we go back to our gold standard, which is surgery, or are there other things that we can do? And the answer is there are other things we do, and there's a lot of exciting things that we have right now.
When I talk to men about prostate cancer, I tell them to definitely get their yearly checkup. I tell them to go see a specialist if they need to. Spare no expense, spare no time. Take care of it as quickly as possible. Adds years to your life. I'm thankful every day that I came to USMD Prostate Cancer Center.
Now, let's talk a little bit about some of the alternatives with, for a robotic prostatectomy. One of the best alternatives, and if you certainly use one of the guidelines, is radiation therapy. One of the challenges for radiation therapy, certainly over the last 5 to 10, certainly after 20 years, but certainly over the last 5 years, is actually becoming less traumatic to the surrounding tissues. And utilizing the true beam and the varium, what happens is that radiation, using specific photons that actually go directly to the prostate, you can minimize the damage of the surrounding structures, as well as some of the nerves which actually run alongside the prostate. As a result, these patients can actually get very good results with few side effects. It's a longer treatment because, routinely patients will require, at least 7 or 8 weeks, sometimes 5 days a week. But routinely, it's a little bit like running a marathon rather than a sprint. And that's what I compare it to patients is that are we going to run a marathon here or are we going to run a sprint? The marathon is sort of like the radiation therapy part of it, which is the fact that every day you're just coming in or 5 days a week, but it's very minimally invasive and there's no anesthesia for that. So those are two of our gold standards on there, and we've got the latest technology for those things, and patients continue to do well. From a surgery perspective, we continue to improve our ability to actually get those catheters out, which is the catheter in the urine channel. We actually do suprapubic catheters now, which is a tube in the belly as opposed to one coming out from the urine channel itself. And that is actually fantastic, and we're now getting a fantastic experience with that as well. So those are sort of our gold standards. And now the question is can we push that even further?
You hear the word cancer and you automatically think that that's a death sentence. That's not the case. My salvation was that I had been doing the PSAs ever since I was 50 years old, annually, and as a result, we caught mine in time. I would place USMD #1 on my list for treatments.
I think that one of the challenges is that looking at our prostate cancer is that are there specific patients that aren't necessarily in the active surveillance protocol, which is that, these guys are, they've got a little bit more cancer, or potentially they're not comfortable following this cancer. Are there things that we can do? And the answer is there are. One of those options is potentially what's called focal therapy. Focal therapy is actually where we go in and we actually just destroy, and actually we routinely right now we actually use ice, which is called cryoablation, and we have one of the world's largest experiences at USMD Prostate Cancer Center, and we actually take small little needles, and it's done under anesthesia, and what it does, it goes directly in the prostate and it freezes it and it just turns it into scar tissue. Now, the challenge with this goes back to my original point, which is if you look at the biopsy, you have to make sure that you're doing a good biopsy so you're minimizing the chance that there could be cancer on the other side. Why do I mention this? Well, because it sounds like a great idea, and it is a great idea, but it has to be investigated. And as a result, USMD Prostate Cancer Center, along with MD Anderson, and there's roughly about 8 or 9 other centers around the country, we are all now part of a large consortium of these centers that are actually going to evaluate this. It's very important that patients do this under a trial protocol to make sure that we repeat the biopsy at specific intervals, we're following them, and making sure that we're not missing anything that could have potentially occurred on the same side or potentially on the other side. And that's exciting, but again, all of this exciting new technologies has to be validated, and we're involved in that significant aspect on that.
At the USMD Prostate Cancer Center, I had cryoablation, which is the process of freezing my prostates in an effort to kill the cancer. Through my research, through what I was told, I had high expectations. It's kind of like I didn't want to go to a hospital where I had mediocre expectations. I had high expectations. I was very happy with everything that transpired at the USMD Prostate Cancer Center, and they met or exceeded all of my expectations.
When I was first diagnosed with prostate cancer, I was surprised that this was a diagnosis. Having gone through this, and what I believe at least at this point is a successful treatment, it's just critical that everybody stay on top of their health and deal with these kinds of issues. That it's not a major problem if you deal with it up front.
Our gold standard wise, again, we talked about robotics, we talked about radiation therapy. Cryoablation, we're still able to do that. We go in and freeze the entire prostate for patients, and that's a great example as well, where we can actually, it's less invasive for that, and we actually just turn the prostate into scar tissue. And then finally, what happens if patients actually do get prostate cancer when, or after they've had potentially radiation therapy or cryoablation? And that's what we call salvage therapy. And salvage therapy comes about because the cancer actually recurs. And it's unfortunate, but it does happen. And as a result, what happens is we start seeing this PSA rise up. Those are the cancers that we want to target. We're actually fortunate in the sense that not only do we have one of the world's largest experience in salvage cryoablation, but we're also now involved in a high intensity focused ultrasound treatment for salvage therapy. How does that work? Basically what we do is it's sort of like a magnifying glass. And what that magnifying glass does is it's put inside the rectum, and we look at the prostate itself, just like an ultrasound, what we do for doing biopsies. We look at the prostate itself, and what it does is it heats up the prostate, and by heating it, it actually destroys it. And by destroying it, it just basically just turns into scar tissue, and it opens up that urine channel. You have to be very careful with this, but again, let's go back to my original point. It's very important that we validate this. We were lucky enough to be involved in some of the most recent trials actually in high intensity focused ultrasound for patients with new onset prostate cancer. And we're now part of that consortium and looking at how those patients continue to improve. Now we're on the other end, which is actually looking at patients who actually have recurrent prostate cancer on there. So to go to your original point, I think that we are constantly looking at all aspects of not only just diagnostics, but in particular the treatment of prostate cancer through that entire spectrum.
If I was to sum up my total experience through my prostate cancer procedure, my experience with Dr. Justin Lee, USMD Prostate Cancer Center, the one word I would describe is success. Success at the ultimate. I promise you. I couldn't ask for a better doctor, a better hospital, and better results than I got. And that's a God thing. And I'm so grateful, so thankful for Dr. Justin Lee and USMD Prostate Cancer Center.
Thank you for choosing the USMD Prostate Cancer Center. Our world-class facility and expert surgeons are here to help you through this difficult and trying time. Call us today to schedule your screening and evaluation at one of our convenient office locations throughout the Metroplex. 1-888-PROSTATE. Learn more online at www.888prostate.com.